Great. Good evening, everybody. My name is Kevin Quigley. I'm the scholarly director of the McLellan Institute at Dalhousie University. We would like to begin by acknowledging that we're based in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. Thanks for tuning in via live stream for our event tonight. This is our first panel on our COVID-19 speaker series. Next Tuesday, April 21st at 7 p.m., we will be hosting a panel on COVID-19's impact on tourism in Atlantic Canada. In a typical year, 7 million visitors come to Atlantic Canada, who generate over $5 billion in revenue for the region. Market observers are estimating a significant downturn for the sector this year. On Tuesday, April 28th, we'll be hosting a panel on COVID-19 and the impact on housing. We'll be looking at a variety of social, economic, and gender-based challenges and hardships that are emerging as a result of the virus and the quarantine. As always, our intention is to support important public policy discussions. We aim to connect local issues to national discourse and national discourse to local issues. After it's concluded tonight, we will have our talk available on our Facebook page and our YouTube channel, as with all our other talks, and we welcome you to share these talks with your colleagues. With respect to tonight's topic, there are several types of crises. They can be brought about by natural disasters, economic collapses, cyber interference, industrial failures, disease outbreaks, violence, war, terrorism, for example. No crisis is exactly the same as the previous one. Crises are perceived, they're interpreted, and they're shaped. They occur in a legal, ethical, financial, public, environmental, and institutional context. They present unique and challenging circumstances. There can be time pressure, shifting conditions, unclear goals, degraded information, and team interactions. They can involve a few people in one place, or as in our current situation, millions of people spread out across countries. Difficult questions about how to allocate limited resources come to the fore during crises. The physical and intellectual challenges and surprises that people endure can be trying, if not overwhelming. Leading under these circumstances can't be easy, and yet it's crucial. Leadership in the formal sense can allow us to make decisions and move forward. Perhaps less formally, leadership can also persuade and motivate. Tonight, we have four distinguished guests, each with a strong and unique perspective on leadership in crises that will help us to understand the context, the concepts, the pressures, the opportunities, and the lessons. I'll introduce each of the four speakers at once, and then each will have about 10 minutes to provide their opening comments. After our fourth speaker, we will invite questions from the audience. And you can ask those questions by emailing them to mipp@dal.ca. That's McLellan Institute Public Policy, mipp@dal.ca, or by commenting on the Facebook video of this live stream. Our first speaker is Anne McLellan. The Honorable Anne McLellan is Senior Advisor at Bennett Jones in Edmonton. She's also the Chancellor of Dalhousie University. Prior to joining Bennett Jones, she had a distinguished career in federal politics, where she served 4 terms as the Liberal Member of Parliament for Edmonton Centre between 1993 and 2006. During her political career, Ms. McLellan was Deputy Prime Minister of Canada, Minister of Public Safety and Emergency Preparedness, Minister of Health, Minister of Justice and Attorney General of Canada, and Minister of Natural Resources and Federal Interlocutor for Métis and Non-Status Indians. As Deputy Prime Minister, she chaired 2 cabinet committees, the Operations Committee and the Security, Public Health, and Emergencies Committee. Our second speaker is Darrell Dexter. Darrell Dexter, former Premier of Nova Scotia, is an Honorary Distinguished Fellow with the McLellan Institute at Dalhousie University. Darrell is also the Vice Chair with Global Public Affairs, which he joined in 2015. Darrell assumed the leadership of the Nova Scotia New Democratic Party in 2001 and led it to form the first ever provincial NDP government in Atlantic Canada, becoming the 27th Premier of Nova Scotia. As Premier, he earned praise for launching a renewable energy strategy, advancing a progressive social policy, controlling spending, and reducing small business taxes. Our third speaker is Sara Napier. Sara Napier is President and CEO of the United Way Halifax. Throughout her 25-year career, she's also held leadership roles with the IWK Health Center Foundation, Nova Scotia Community College, the Region of Queens Municipality, and various nonprofits. Sara is a graduate of the Sobey School of Business at St. Mary's, Mount St. Vincent University, and the NSCC. She has received the Halifax Progress Women of Excellence Award, an Innovation of the Year Award from the League of Innovation, and an Alumni Impact Excellence Award from Sobey School of Business. Our fourth speaker is Jim Barker. Jim Barker is the Herbert S. Lamb Chair of Business Education in the Rowe School of Business and leads the Safety Net RX and Health Assured Pharmacy Safety Research Consortiums. Professor Barker's research interests include complex organizational behavior, ethics, and sustainable processes with a particular focus on leadership, safety, change management, and stakeholder engagement. Professor Barker is a former U.S. Army officer and has served as a faculty member at prestigious U.S. and New Zealand universities. He has management experience in transportation and consultative experience with a number of industries and government organizations. So on that note, I'll now turn it over to Anne McLellan, who will start us off. So, Anne McLellan.
Thank you very much, Kevin. And it's a pleasure to be here this evening. Whoops, am I supposed to start my video? Sorry, do we have a technical glitch already?
And just start your video there and you should be all set.
Sorry, there. Okay, sorry about that, ladies and gentlemen. It's a pleasure to be here this evening. And not surprisingly, my comments this evening are going to be from the perspective of a minister in the government of Canada. During my time in the governments of Prime Ministers Chrétien and Martin, notably, we dealt with both the ice storms in Eastern Ontario and Quebec. We dealt with 9/11 and we dealt with Sars. And to Kevin's earlier point, I think three very different types of crises, but I actually have come to believe that the attributes and approaches that leaders need to display, regardless of the type of crisis, are similar. Obviously, during a crisis, you need to display attributes that are not always associated with the government and government action. During a crisis, you need to be nimble, you need to be flexible, you have to be adaptable to new circumstances which may be coming at you very quickly and unexpectedly. And certainly that was the case with SARS, and that is certainly the case with what the government of Canada and all of us are dealing with in relation to COVID-19. Crises throw you curveballs. So it is so important in terms of being nimble. And for example, we did not expect to land over 300 planes on 9/11. Canada didn't have a plan that we hadn't prepared for the possibility that airspace would be closed basically all over Europe, the United States, and the world, and we would have hundreds of planes with thousands of deaths on 9/11 unless we agreed to open our airspace and land those planes. And that requires nimbleness, it requires on-the-spot decision-making. And that's what happened on that day, largely because of our Minister of Transport, his deputy minister, and the Prime Minister assessing the situation quickly and making a very tough decision, because we did not know whether any of those planes that landed or came into our airspace could actually have terrorists on board and be planning a terrorist attack. But you have to deal with those situations. You have to take the information you've got and make the best decision you can. Vigilance is important in crises. And I think you see that playing out right now, and it certainly played out for us in SARS. You can't take your eye off the ball. Sometimes you think, okay, the worst is over. The peak is over in an infectious disease. And maybe you don't take your eye off the ball exactly, but maybe you let up. Maybe you and your public servants take a big sigh of relief and say, boy, we think the worst is over. or maybe your first responders, your frontline hospital workers. Take off some of that PPE, and all of a sudden you're into phase 2, which is what we dealt with in SARS. We thought phase 1 come, we all took a deep breath. And what happened? We had phase 2, and phase 2 in some respects was more harmful than 1, certainly psychologically. So in a crisis, vigilance, and vigilance is hard. It tires you out. It tires your first responders out. Ever watchful, but leaders, I think, have, in leading the team, they're the ones who make the argument around constant vigilance, and they lead by example. No, we can't let up. We can't take our eye off the ball. Communications are key in a crisis. This is one of the hard lessons I learned in SARS. We, at least initially in the SARS crisis, did not communicate effectively enough with the Canadian people. And one of the hard lessons, I say, that I had to learn was that, in fact, people wanted to hear from, I was Federal Minister of Health. They wanted to hear from the Federal Minister of Health. They wanted to hear from their government. And it is important to be transparent around what you know. During a crisis in government, you're not going to know, in most cases, all the facts. You're learning them almost on an hourly basis with some crises. But the public wants to know, it wants to be reassured that you're doing your job, and you share with them what you do know, and you're honest with them. So you're not only informing the public, you're building trust with the public. And I think that's what you see very much with COVID-19. Why the Prime Minister's out every day, why premiers are out every day, why ministers in charge of the file at the federal level are out every day. They are sharing transparently what they know to inform and to build relationships of trust, because they know the public is fearful, is anxious. And I just can't accentuate enough that leadership during a crisis requires effective communication. And as I say, I learned that lesson the hard way during SARS. Also, I think crises provide elected officials, leaders, with opportunities. And I would give you examples of 2. With SARS, we knew that the public health system had been degraded at the federal level and across the country. People were not investing in public health the way they should have, hence some of the issues and challenges we had dealing with SARS. So what we did was take the opportunity of SARS to rebuild the public health system at all levels in this country. And people can debate today whether, in fact, enough human or financial resources were put to and are being put to public health today. But crises do present you with opportunities. We took the opportunity to create the first ever public health agency, first ever chief public health officer. We took the opportunity to rewrite the Quarantine Act for the first time in 100 years and make it clear the powers that the Minister of Health had in a crisis to protect Canadians, which you see this Minister of Health using during COVID-19. So take the opportunities as a leader that the crisis presents you to make things better going forward. In relation to 9/11, another example, we did not have an anti-terrorism act. We had been talking about it, governments have been talking about it for a long time. We had not ratified some of the United Nations conventions dealing with air terrorism and other things. Some of those things were not without controversy. We took the opportunity after the crisis of 9/11 to get our house in order and make sure we were doing the things that we believed we needed to do to protect the national security and well-being of Canadians, while at the same time ensuring the protection of their civil liberties. So crises, I think leaders need to not only deal with the crisis, and when you're in the middle of it, that's your first and foremost job, but also be thinking about the opportunities that might come out of that crisis to improve things for Canadians going forward. Keep in mind, during a crisis, perfection is your enemy. It is the enemy of the good. It is the enemy of you doing what is necessary in a timely way to protect your citizens. Public servants, and dare I say elected officials, love to cross every T, dot every I. Otherwise, we're called out if we don't, especially in the world in which we live today with 24/7 social media. But it's just not possible in most crises. You are getting information almost on an hourly basis. You have to respond to that information in the best way you can. And it's not going to be perfect. And what you're going to have to do is acknowledge that. Don't pretend it's perfect. Leaders never do that. They acknowledge the fact it's not perfect, and they say, quite honestly, to Canadians that, in fact, we'll fix it on the other side if it's not perfect. And you even see during a crisis, things are not perfect. Right now with COVID-19, what you see is the Prime Minister, the Minister of Finance, and others going in and tweaking brand new programs. They are tweaking those programs as they get more information, as gaps in the programming is identified or are identified by stakeholders, by the opposition to them. They're going in and they're fixing it. And there will be lots of time after the crisis, lessons learned, to, in fact, deal with the things that didn't work quite as well as they should have, and so on. Perfection. I think during a crisis, the last thing anybody has time for is perfection. And you're not doing your job as a leader if, in fact, you're not instilling in your team the confidence to do what you believe is necessary on the basis of the information that you have. And you say, it may not be perfect, but we are going to deal and keep as many people safe as possible, as quickly as possible. We'll deal with the imperfections on the other side. Leaders don't micromanage. I had a tendency to want to micromanage. My staff would say, Minister, that's not your job. Your job is to lead. It is not to micromanage. Let someone else worry about whether the system, which you, Minister, don't know the guts of, let someone else worry about whether the system is working exactly the way it should. You, in fact, set the frame, and you lead the team, and you hopefully lead Canadians and reassure Canadians. But leaders do not micromanage during a crisis. It's a waste of their time. And my final comment, the longer a crisis lasts, the more likely the blame game will be played. That certainly was true in relation to Sars. I think you see it playing out right now, starting to play out in COVID-19. There is no question that the longer the crisis lasts, the more actions leaders have to take to deal with the perceived problem, the more likely it is that people, it could be legitimately elected opposition, it could be the media, it could be armchair critics or quarterbacks, the more likely it is that the blame game starts to roll out. Leaders can't be defensive about that, and they can't be distracted by the blame game. You can't respond to what you believe to be every misspoken or misinformed accusation or allegation. There's going to be plenty of time, lessons learned after the crisis, to deal with what allegations, assertions, misinformation that you as the leader believe were unhelpful, to say the least. Leaders can't become defensive during a crisis. They don't have time to be defensive. They don't have time to play the blame game. They have to stay focused on the crisis. And I think I will stop there. Over to whoever's next. Darrell, I think.
Yep, next up is Darrell Dexter.
And there I am.
There you are.
You can see me?
Yep.
Okay, well, first of all, thanks very much for the invitation to be with you tonight, and to all the people who are watching, because it means, of course, that you are staying the blazes home, and I'm glad that you are. It's always dangerous to follow Anne McLellan. She's covered a lot of material. All of what she says, I think, is very much relevant to the way that we ended up acting throughout the H1N1 crisis. So what I'm going to do is I'm going to talk a little bit, maybe give a little bit of background, and then share some of the curveballs that Anne talked about that came up over the course of the H1N1 pandemic crisis. But before I begin, we're talking about crises. And the word crisis actually comes from an ancient Greek word, crisis with a K, and it means decision or judgment. And that's what a crisis is. It's a moment of decision or a moment of judgment, and that's what leaders are called upon to do. And quite rightly said that you are not able to necessarily, you have to act on what you have and make the best decision on the information that is available. I was elected premier on June 9th of 2009, and on June 11th, the World Health Organization declared H1N1 a pandemic. And so literally 2 days after having been elected, there was this crisis that had been declared. But it wasn't the only crisis that was underway at the time. You might remember, if you cast your mind back to 2009, that at that same time, there was a financial crisis going on. October 2008, the financial systems of the world had essentially melted down. There was going to be extreme financial consequences for economies right across the world. Nova Scotia was not going to be insulated from that. Government revenues were going to suffer. There was economic dislocation. There was a lack of available credit to companies. And we knew that in the midst of all of this, we were going to have to try and manage the economics of government to keep funding the important social programs, to continue to be able to operate all of the services that the people of Nova Scotia would expect. So we essentially had two crises that were happening at the very same time concurrently. So it looks a little bit like what's happening now. In our case, the financial crisis started first, and then the pandemic happened. In this case, of course, a much more lethal pandemic, but the financial crisis came essentially at the same time. So throughout the transition period into government, virtually every day we were being briefed about the ramifications of the worldwide financial crisis and the ramifications of the pandemic. So we had to figure out, how we were going to respond to both of these things at the same time. And literally, when my cabinet was sworn in, the Minister of Health, as she walked off the stage, was taken aside by the Deputy Minister of Health and briefed on the H1N1 crisis, because there were things that she needed to know immediately. And I would say that I was lucky to be blessed with an exceptional Minister of Health in Maureen McDonald, who worked through many of the difficulties in responding to that pandemic in a very exceptional fashion. I would just note for everyone that the response to a pandemic is not something that takes place, from the ground up every time one occurs. The reality is that pandemic planning in healthcare is an ongoing function of government. So we had the benefit of the lessons that had been learned through Sars and through other pandemics that had happened. And so in this one, the government has the advantage of the experience that happened with the H1N1 crisis. And that's important because, in fact, in our province at this time, the Chief Medical Officer of Health, Bob Strang, who we see almost every day now, was the same Chief Medical Officer of Health that we had the opportunity to work with back in 2009. So in both of these crises, there were, I think, two important responses that we needed to put in place. There needed to be an organizational response, and then there needed to be a communications response. And you see this right across all of the jurisdictions today. The organizational response is largely internal, although it does get dissected carefully by the press and by the opposition parties and by critics. But the organizational response is, of course, what actually delivers the service to people that they're going to need in these circumstances. So the making sure that the lines of communication are properly in place, making sure that the reporting functions are defined, ensuring that the responsibilities that are defined, that mandates are assigned, all of these kind of organizational, administrative things that you would expect, except, as Anne rightly noted, they have to be extraordinarily nimble. They have to be able to make decisions quickly, respond to the events as they're occurring. And as my good friend Paul Black said in a recent article in the Chronicle Herald, speed and precision is not something that governments are necessarily known for. And so this is forcing the departments to put aside their smaller interests for the larger public good. I said that I would mention a few things that went wrong, and I realize that the time's at a premium here, but just to give you an example of one of the things that you probably wouldn't expect. In Nova Scotia at that time, the healthcare community, the healthcare resource community was divided up into different bargaining units among the various unions who represented nurses in rural facilities versus nurses in Halifax. Various memberships were represented by different unions. And we were fortunate to have those unions come together and to agree that in these circumstances, all of these, what would normally be questions associated with where bargaining units work and how human resources are moved around, would all be put aside. And they for those of you who remember this, there was actually a document called the Good Neighbor Protocol that was signed, and it allowed the government, it allowed the healthcare system to be able to move those resources around in order to make sure that we were meeting the need, no matter where it was in the province. The other thing that happened that was not expected was that the federal government at the time had decided that the manufacture of the vaccine, and I think this is an important point that I'll get to in a second, because one of the advantages that we had was we had an exit strategy, which is more difficult in the current pandemic. But the government of Canada had decided that they would put the manufacture of the vaccine in the hands of a single manufacturer. And what happened is, as the second wave of the pandemic and the H1N1 pandemic in Nova Scotia essentially went through two waves. It went through a July wave and then a second wave that came kind of in October and November. And just as the second wave, which was the much higher of the two, and as that happened, the manufacturer lost batches of the vaccine. So that meant there was a shortage. And so I remember very well the conference among the premiers talking about, how the vaccine that existed was going to be allocated to the various provinces. Obviously, everyone is, in the position of wanting that as much of that vaccine as they can get their hands on for their particular population. That was something that was not foreseen. And I believe that the federal government absolutely learned from that, because I don't believe that that situation has been allowed to arise since. The second thing that I would point out is that that the communications response is really important. No matter how good your organizational response is internally, you have to have the public buy into the program that you're delineating for them, the instructions that you're giving them. And I think you've really seen kind of a master class in these kind of communication responses from the various jurisdictions across the country. In Nova Scotia, we decided, and the Minister of Health decided, that we would make sure that all of the medical professionals were up front, that they were the ones who were delivering the message, and the Minister of Health and the Premier would be there to support them and to assist where they could. We see many kind of different styles of communications today. Our premier sits behind a desk with the minister of with the chief medical officer, and essentially allows the chief medical officer to do the reporting, the necessary medical information that people need, and then he brings the kind of weight and force of the office to drive in the gravity of what the chief medical officer is saying. I guess the last thing that I would like to say about this is that there have been very important questions that has arisen from the current pandemic. As we look at, and much like the shortage of vaccine, as we look at things like the shortages of personal protection equipment, as we look at the shortages in ventilators, the various things that we have seen, it raises the question about health, human resource security, health supply security, even food security. These are issues that we really haven't considered in the past, and I think this will be one of the lessons that will be learned. And I think there will be a healthy debate in our country following the end of this pandemic about how we're going to address those for the future. It will be part of the lessons that need to be learned in the current pandemic. And I'll end there. Thanks very much.
Great. Thanks, Darrell. Sara, you're up next. All set. All right, you're all set, Sara.
Okay, great. Hi there. Hi, everyone. Thank you so much. And I'm really delighted to be joining you. I'm going to speak more so from a nonprofit perspective and how we're viewing the community at this time and the types of responses that are influencing our everyday. So first, for context, I think it can be said that the world is always in a state of crises. So whether that's a social, environmental, or economic, or another type of crises. And it's true to be said as well that United Ways are always working in that context of crises. So in particular, we're trying to solve social problems, making our community better, more equitable. And this mindset can really help organizations to innovate, be really clear on purpose, and also to have a really strong ambition for good. So you take that context, especially when you're thinking about individuals living in poverty, for example, where every day is indeed a crisis. You add COVID-19 and the urgency, complexity, uncertainty, severity of an already present social crisis magnifies. And I really strongly believe that the need to have a crisis view is absolutely something that should be ringing true for any organization all of the time, and that can inspire such important urgent work for what matters most in our community, whether an organization, a leader, or a system. So that takes us a little bit more to today and COVID-19, and I'll share a little bit about what United Ways in Atlantic Canada have been doing to respond to this crisis. And what we did, we established something as a collective. We established the Atlantic Compassion Fund. And this is a fund that supports people who are most impacted by the widespread public health measures being implemented across the region, including those who are precariously employed, experiencing homelessness, mental illness, or food insecurity, as Darrell just mentioned, or living on a low income. And this is an Atlantic fund that, even though it's managed by the United Way here in Halifax, it's operating in collaboration with 10 other United Ways across the region. And it's designed to help people meet basic needs, certainly reduce the impacts that are further marginalization, And also, really importantly, the fund will help to equip our communities to bring people back together again when the time is right and safe to do so across Atlantic Canada. And to give you a sense of the scope of that fund, within the first 3 weeks, because it's a brand new initiative, within the first 3 weeks of operating, the fund has raised over $1.6 million in Atlantic Canada. And across the region, we have already distributed hundreds of thousands of dollars here in Halifax alone, close to over $350,000 of impacts and supports to frontline organizations. So we know that there's an ability to be nimble and quick in crisis scenarios. That's something that both Darrell and Anne spoke about. So I'd like to spend a couple of moments thinking of this as being the inspiration, the Atlantic Compassion Fund and COVID-19 and the realities that we're all facing. I'd like to use that as a bit of a pivot point to talk about leadership characteristics, in a crisis that are critical for in working with all stakeholders, whether those are employees or, in our case, donors, also board members, volunteers, partners, community members, etc. And I have 10 that I'm going to go through very, very quickly. Some of them repeat upon and further emphasize what has already been said, so I'll be brief. But I'll just go through those and then speak a little bit to the challenges and some lasting thinking around legacy. First and foremost, really important to be decisive, confident, and calm. People are relying on leaders at this point in time in a crisis, anytime, but especially in a crisis of fine point of COVID-19, to set the right tone, to provide honest, accurate perspectives and assurances when feasible. And when feasible, meaning when actually leaders are able to provide assurances on what is to come and what can be expected in our communities. Anne spoke about this as well as a second comment, not letting perfection be the enemy of the good. Certainly needing to use speed, to be really responsive, and the actions and letting the community know that they're cared for is much more important than any other kind of journey towards perfection. Number 3, being really compassionate and being very present. One thing that has been very true for us at this point, and this rings true for community, for staff, and all of the other stakeholders that we've been working with, it's so important to demonstrate genuine care for the people who are in your sphere. We're all humans making our way through this together. And we're doing that as people, not as, for example, employees or another role that is being played. So it's really important to view one another as humans and lead with your heart and understand with your heart from those perspectives. Number 4, being very transparent and communicative, and doing so, communication regularly with a lot of frequency and with humility and honesty, and being very direct and even being willing to say, I don't know the answer yet. And that's a really important thing that I've seen happen among many leaders in our community at this point dealing with this crisis. And I think that has such credibility and such importance to let people know that you're hearing them, even if you do not have all the answers in an ever-evolving moment in time. Number 5, being very adaptable and having a learning mindset and being very open. I think it's really critical not to overcommit to a set plan. When conditions are changing constantly, it's really important to be fluid and ready to move in a brand new direction if that's what's required. Number 6, creative and full of ideas. Crises can lead to new thinking. And as the saying goes, necessity is the mother of invention. So really thinking about that of here we're at a point of extreme necessity. So what is that meaning for how organizations and how leaders are responding to managing issues? Number 7, being very collaborative and having a systems view of a solution. So traditional silos no longer matter. They shouldn't matter anyway, but they definitely don't matter in an extreme crisis. And it's critical to work as a fabric and in a network. And it can even be effective for government, nonprofit, community business, education, other types of sectors to be working together to fight a shared issue or problem, really leveraging their unique assets and strengths. And for me, the theory of collective impact really comes to mind in this moment. Number 8, thinking beyond the present to the next and the after. So when considering decision-making and planning, really being mindful that yes, you have to be laser focused on this exact moment, but very aware and thinking about what is happening next, so that we keep that, longer term view of what's in mind. Number 9, I think gratitude is really critical for leaders in this point in time. A friend of mine, wrote a book about gratitude. His name is Steve Foran, and he talks about this notion of moving from surviving to thriving. And so how are we thriving, and how are we being grateful for what we do have to make good decisions, to care for one another, and having a really healthy, positive mindset. And 10, being focused on that lasting change and legacy. And I really believe that every crisis can have a legacy of good. So thinking about what that can be is the most important imperative. So in terms of challenges in times like this, and especially for thinking of a nonprofit context, the notion of that VUCA world of volatility, uncertainty, complexity, ambiguity, all of these things are just on steroids right now. So how long is this going to last? What is the extent of the impact? How is the mental health experience for employees, for community partners? There's so much challenge. There's so many challenges, pardon me, in this VUCA kind of context. Certainly, economic and revenue challenges are huge, and I really do worry about the viability of the nonprofit system to be supporting the quality of life of our country. As it's an imperative part of our community. It's not a nice to have; it's a need to have. And what does this nonprofit fabric look like after a crisis like this, and how are we thinking about the future of our community with nonprofit being hand in hand? Sustainability and survival are critical challenges to be considered. And speaking as one is really important. How do we do that as a community and really stay focused on what we're accomplishing together rather than falling into old patterns is very critical and a big challenge. And then I worry about some of those societal challenges, whether it's the extent of fear, divisiveness, racism, protectionism. What are some of those things that come up in a crisis that we really need to be fighting, and that we don't want to affect our community to the negative? And how are we mindful and purposeful about talking about those issues and being really positively oriented? So just being aware of some of those challenges is really critical from a leadership perspective for leaders and organizations. And that's, I think, the starting point of being aware, thinking about them, and then what do those challenges mean in terms of how you show up every day to do your work. And just for a closing thought about what, in my opinion, of the leadership behavior that is most important at this point in time, I strongly believe we must answer and act on the question of what is the legacy of this crisis? What do we learn about how economic or social justice and public health factors collide to change our systems for the better? Related to income, perhaps, or housing or inclusion. We know that there are many shelters in our community and homeless shelters that have had to change practices to be more appropriate, frankly, at a time when social and physical distancing was not possible to be aligned. After a public health crisis, we can't go back. So what's the permanent solution of going forward? That's one example, but what are all of those matters in our community that we can learn from COVID-19 and say, the normal that we knew before is not going to be known again. So how are we moving forward in terms of the next step with a different level of thinking around sustainable, permanent changes of policies and practices that perhaps always needed to shift, and now they can, based on the shining light of a crisis. And so I think that will be our true leadership test. Thank you.
Thank you very much, Sara. And I also want to thank everyone else that has joined us out there for coming in and being with us tonight. And I particularly also too want to thank Darrell and Anne for their comments. What I want to do now is to talk a bit about general understandings that we have of leadership in a crisis, particularly leadership as it comes from government institutions that Anne and Darrell represent, and leadership also from our institutions like United Way that serve the public, or the not-profit institutions, but this public service part of it, which are vital in crisis kinds of situations. The key thing that we have to remember, because as we watch the media these days, we see a lot of information. We see a lot of graphs, a lot of charts, a lot of projections as to what numbers will be, what time we can come out of lockdown, all of those kinds of things, what time we can get the economy back, losses, other kinds of things. All of those numbers, all of that information only informs the decisions that we make and the choices that we make right now. They inform us. They don't tell us exactly what that choices will be. They just inform those choices. There was a mention about that Darrell made about a moment of judgment, and that is really key for us to understand, because in terms of leadership, what is presented in a time of crisis are those moments of judgment, and those moments of judgment are communicative. They're not, although it may think it's one individual making a decision, it's not. It's really collective. There's collective exchanges of ideas, collective exchanges of information, reactions to various information, reactions to statement by leaders, by their constituents. It's a collective communicative phenomenon that's going on, and that phenomenon requires good judgment. So that's why those moments of judgment are so important for us out there. And now, how do we get there? How do we try to position ourselves as leaders in these kinds of situations to be able to effectively respond to those moments of judgment? There are three key elements that we see coming from the research. The first key element is about stability. And that is really what we need. We need stability. We, meaning the people that are out there in a crisis, we need a sense of stability. But stability doesn't mean everything is constant. Everything is just status quo. It doesn't mean that at all. For us, stability means our ability to move forward in a useful way. That's what we need with stability. We need to know that we are moving forward, that we are making progress, and we're doing that usefully. And that's what we look for institutions to provide in times of crisis. We need institutions to project that way forward through the uncertainty that we're existing in the present moment. We need to feel that work is getting done, that we're moving forward in a positive direction. So we see, again, we go back to one of the things that Darrell said about the idea of the organizational response and the communicative response. You put an organizational response, a communicative response together, you get stability will come from that. And again, it's that general feeling that we have as members of the organization, members of the community, that we are moving forward effectively. Anne was talking about nimbleness and the adaptability, but again, remember, stability doesn't mean exactly constant. It means moving forward usefully, moving forward in a good direction, that we feel that we're all doing that together. And nimbleness is a key aspect of that. We have to be able to change and adapt, and to do that effectively. But the key part to come for this about stability and what's projected by stability was something that Sara said. Remember, Sara talked about an ambition for good. The purpose. Why is the organization there? Now, that why is easier to do for nonprofit organizations, community service organizations, for-profit organizations. It's a little harder to do for a government organization. But what do we really need from that government organization? Stability. What's the purpose of it, particularly in a crisis? Providing that sense of stability. So as you hear these elements, as we hear the speakers talk, particularly as we hear the Prime Minister, the various premiers, the medical service officers like Dr. Strang here in the province, Dr. Tam on the national level, we hear them projecting that sense of stability as we're going forward. Second key element to that is confidence. We need to have a degree of confidence that we are moving forward. So on one hand, we need the ability, that stable ability to move forward. We need to have confidence that we are moving forward. And that's very much a communicative element. Remember how Sara was talking about tone setting and empathy and that genuine care. We need to feel that. Remember, this is a communicative phenomenon that's going on, a collective communicative phenomenon. Our leaders projecting a sense of empathy. Our leaders setting a useful tone for engagement. Our leaders projecting that sense about genuine care. That's important for us. That helps to give us confidence that we are moving forward in that useful direction. And go back, a key thing that Anne said. At one point, Anne talked about this is what people wanted to hear. She was talking about the hard lesson she had learned, and that lesson was about what people wanted to hear. What they're wanting to hear is confidence. They want to hear a message that gives them confidence that we are moving forward in a very useful direction. The third element is consistency. So we need stability. We need the confidence that we have that stability. To get that, we need a consistent message. Again, look at the examples that we have here. We have the Prime Minister talking at a set time each day. We have the premiers all talking at a set time each day. The medical officials and officers talking at set times. It almost seems trite a bit, but it's actually very important to have that degree of consistency. The messages that we get, the stay at home, wash your hands, all of those kinds of messages are pivotal to what we're doing and what we need to be doing there. And another key element in bringing this part together, I want to focus on one of the elements that Anne talked about. Anne talked about vigilance and a need for vigilance. That vigilance helps us get consistency because it's vigilance about how the message needs to change to keep consistent about the purpose and what we should be doing. And that does take vigilance because there's a lot of changing, a lot of working, a lot of moving that goes on out there. And that becomes another key element for us, is to have that degree of vigilance so that we can adapt very quickly and very powerful. And again, we keep the focus in the consistent message that focuses on what we're trying to project and that sense of care, perhaps, that Sara was talking about. So what we need to see then, and what we really need for our key leaders, and we heard that discussed with Darrell and Anne and Sara tonight, is that message about consistency, which gives us confidence and gives us stability. Because if we lose any one of those, if we lose consistency, we lose confidence. We lose confidence, we lose stability. We lose stability, we as a people will struggle. And we'll keep struggling until we get it back. So that becomes the imperative that we have in these kinds of crisis situations. I want to close with the idea, coming back to the sense about judgment and the space for judgment. Again, remember, all of the information that we have coming at us only informs what we do, how we think, how we act. What we look for leaders, particularly leaders in those institutions, is to provide that sense of good judgment and to help us understand what are the choices that we need to be making right now. One of the key things that we as a people need in these times of crisis, we need to be able to take short-term actions that we can see a long-term benefit for, some way of getting out of a crisis situation. So things as simple as washing your hands, staying the blazes home, all of those elements become important. What can we do as a people? And that is a key part of that consistent message that builds confidence, that gives us the stability that we need. And Kevin, I'll close my comments there, and we'll open it back up now for the questions.
Thanks so much, Jim, and thanks so much to all the panelists. I've taken some notes, and I personally have, of course, jotted down quite a few questions I've got. But the way I'll ask the audience to respond is if you can post your questions on Facebook as directed earlier, or send an email to mipp@dal.ca, and Warren will receive those questions, and we'll ask the questions of our panel members. Now, we encourage you to ask a particular question or direct your question to a particular person, so we can go through a few questions that we can. and yeah, get through as many questions as we possibly can, I suppose. So we can encourage you to think about a particular question you'd like to direct the question to. That said, panelists always have the right to signal they would like to answer whether the question's been directed to them or not. On that note, I'm going to start us off, though, while people are thinking about their questions and sending their questions in. I think this is a question about leadership. I'm not 100% sure. We can maybe tailor its leadership. And I have thought throughout this panel, I think I'm going to ask this question to Anne. And then I thought, oh, maybe Darrell would be a good person. Oh, Sara could probably answer this too. And then I thought, actually, Jim would answer this question. So I'm going to cheat right off the bat and throw the question out to see either whether somebody wants to take it or if you want to just offer some reflections. But so I do a lot of work around emergency management and risk governance and things like that. And a lot of references throughout your presentations to different events that have happened in the past, SARS, H1N1, of course there was MERS. And over time, we've seen this incredible buildup of institutional capacity around pandemics. And in fact, I remember interviewing a senior civil servant about 12 years ago, maybe 10 years ago. And she brought to my attention, actually, that provinces were very concerned about pandemics. It was one of their principal concerns, and they wanted assistance. That's an area where on emergency management, for example, they wanted to see more collaboration. So because we're in the middle of it, it's hard to know whether we're doing it well or not. And I guess that's the thing. So it's not like we can conclude that we're doing it well, or there's certainly some things that we're doing right now that are remarkable. But I do find myself wondering, were we caught off guard despite efforts and years and decades of planning for a pandemic? And when I think about H1N1, I think, at the time they were surprised it came from Mexico because they said, this thing's really probably going to come from Asia. When a big one comes, it's going to come from Asia. It seemed there were so many things that we had right about this. And yet, now that we're experiencing this sort of phenomenon, were we caught off guard still? And what does it tell us about organizational response, organizational leadership? But maybe I'm being too harsh. I don't want to, I know there's some phenomenal things that are going on, but obviously key to it is also being very proactive. And so we seem to be doing a lot of the stuff over time. Are we surprised by the reaction? Are you surprised that we weren't quicker on our feet? Anne, you want to kick it off?
Well, I think there's this challenge, and there's probably a lot of this in the literature, Jim, about leaders in taking action before they're sure there's a problem, right? That you don't have perfect information and you have fragments of information. And, I think as with SARS, although much better, with COVID-19, the Chinese were much more forthcoming, more quickly in terms of where the infection started, how it started, what they were dealing with in Wuhan. It took us a long time to get basic information during SARS, but you get fragments of information. And as a decision maker, you have to decide, should I move now? And how should I move now with these fragments of information and run the risk of overreacting? Or should I wait until I have better information and know more about the spread and how it spread and how quickly, and perhaps be accused of underreacting? That is always the dilemma in a crisis. Am I going to overreact or underreact? The only way you can make that decision is on information, and you always have imperfect information. So you have to deal the best you can. And to Jim's point, it's judgment. It's taking that imperfect information and trying to make the best decision possible in the circumstances and inform Canadians in this case. Again, you don't have perfect information, but the information we have is based on science and the advice of our chief public health officers across the country. And we are doing what we believe is appropriate at this moment in time. So I am not going to say that the government, any government, acted too slowly. I think we may discover better information and learn more in a lessons learned exercise, right? That's why lessons learned are so important. You know, after SARS in particular, the one I'm most familiar with, I mean, we learned an awful lot about public health, and that's when we started to rebuild the public health system. But what are we seeing? We're seeing that we need better stockpiles of PPE, right? We learned that lesson, but obviously not well enough coming out of SARS. The level of collaboration and coordination, however, is much, much higher than it was during SARS. I don't know what it was like, Darrell, during H1N1, but during SARS initially, it was not good. We weren't sharing the way we should at different levels of government and with the WHO and around the world. I think that has changed a lot. And based on what you were saying, Darrell, probably you saw a higher level of collaboration and cooperation during H1N1.
Sure, there was you know, a federal provincial table that was meeting regularly, that were talking, information was being exchanged, those lines of communications were open. I think the difference with this pandemic is just the level of lethality. We haven't really experienced that before, and as you were speaking, I was thinking that, and I talked a little bit about the ancient Greek word crisis and what that means, but so I'll use another Greek word, which is hubris. And we have a certain level of hubris about the ability of our medical care system to be able to respond to these things. And, perhaps one of the things that's coming out of this particular pandemic is to understand, as you pointed out, that the healthcare system really has not, we ask the healthcare system to do more and more and more every year, and we're not putting the money in it that we need to put in it in order to be able to respond to these kinds of events. And you saw in the United States this tremendous kind of outpouring from all of the governors saying we need more ventilators, we need more ventilators, and then suddenly the governor of New York stands up and says, oh, well, wait a second, we actually need somebody to operate the ventilator. So it's not just about the supplies. I mean, you have to have the health human resources to be able to support the system. So as you say, this will be a learning experience.
Sara, if I can just go to you, you talked about kind of being not comfortable in a crisis, but you're an organization that frequently has to address crises, and long before this one. Do you have the surge capacity? Did you feel that you had sort of rehearsed surge capacity so that when an event like this occurred, you could meet it? Or how would you respond to this?
Yeah, no, it's a great comment, Kevin. I mean, a couple of different things. One thing that we've been able to respond to is because we've been working collectively in the region. So working as an Atlantic region with some of our counterparts. And we've really only been doing that in a strategic, deliberate way in the past 6 months. So if we weren't doing that, we wouldn't have been able to act as quickly as we have, and in particular in terms of the Atlantic Compassion Fund. But when you think about the overall sector and the readiness, some of the things that we're encountering and hearing about are organizations, if you think about a shelter or a community organization who's reliant on volunteers, reliant on employees who may be in high-risk scenarios, they're not equipped to when a crisis like this hits. So all of a sudden there may be employees who say, I don't feel safe working in this environment. And I have to go back to my family, and I cannot continue with this employment in these circumstances. Or it could be another organization that does not have the monetary resources, or maybe they're more reliant on volunteers. And so they don't have that plan to be able to operate in the context of an extreme crisis when everything gets upended. So in terms of a preparation, I think it's things that we think about that I think it's very, very challenging when resources are slim. And so it's cases like this where, I mean, I believe, and I in my comments saying that there's no turning back on some of these issues. It's like what's next, and that's really the most important piece from here. But what's popping up in these moments that is actually helping us be more prepared, and I hope that those lessons do stay. So when I say that about our sector, it's not a criticism; it's a reality of resourcing and of really trying to work together to do good things, but really struggling on a day in day out basis to do so with so many different limitations.
Jim, I want to go to you for your thoughts. Then I'm going to go to ask Warren if he's got pick up some questions. I want to modify it a little bit for you, though, Jim, in light of some of the comments that the others have made. You talked a lot about the importance of stability and routine and forward momentum in a sort of predictable manner. And so I appreciate that point. One of the things I wondered about, though, is it seems to me when I think about particularly Sara's world, about some people who feel they're not part of that stable solution. So there's some organizations that are trying to bring routine and stability, but there might be some people in our society who feel that the stability is not for them, like they're on the fringes of this and they're not being accommodated by the stability we're trying to develop. How would you address that challenge, do you think?
Well, one of the things that we hear talked about, or it's a word that we hear come out a lot, and I heard it several times today in the discussions that we were having as a country today about how we're going to work with the crisis of COVID-19 in the long-term care facilities. But the word that kept coming up was conversation and bringing people into that conversation, the necessary people into that conversation to help us craft that response. It's that sense about voice. And again, remember, this is a collective communication phenomenon that we're all dealing with. So voice becomes important. Who is included, who's excluded? Those are very, very key elements that we have to be conscious of and understanding of, and work at ways to facilitate bringing in the different kinds of voices, particularly for an organization like what Sara works with. Again, going back to what Sara said about the point, I want to make sure I get it right, the ambition for good, that purpose that you have. Using that as the guideline for judgment around the voices. If we are going to focus on our ambition for good, or if we're a government organization and we're going to focus on the common good or the collective public health, whose voices need to be a part of that, and how do we bring that in? It's not easy. It's not easy at all. But it's what we have to do. We have to work at, and again, we'll see the leaders that we are seeing so much of now. But we see them trying to do that, and again, for me, I was really struck by how often that word conversation came up in all the different kinds of media sources that was happening just today, and dealing with this one particular issue in COVID-19 response today. Right
on. Yeah. Warren, we got some questions.
Yeah, we've got a lot of questions, so hopefully we can get through as many as possible. The first one I think would be for Anne. Trump just announced that the U.S. is planning on cutting off funding for the World Health Organization. Will this help or hurt our fight against COVID-19?
It will hurt the fight against COVID-19 and will hurt global health. And America has always been a strong supporter of the WHO and the United Nations. I mean, they've had their ups and downs, but certainly nothing like they're going through right now. I think the problem with the president, the WHO is a multilateral organization. It's part of the UN. I think President Trump has made it plain he doesn't like multilateralism as an approach to the world's organization. And I think absolutely not providing funding to the WHO will not make America safer. It will make it less safe, because so much of the WHO's resources go into developing countries where there are poor healthcare systems, where they do not have the research, they do not have the supplies. But because we live in a global world, people travel. So we have to take that on board, that we are only as safe as, if you like, I hate the expression weakest link, but the poorest country with the poorest healthcare system and the poorest public health, because whoever that country is, they can export to the rest of the world unintentionally, obviously. And therefore it is so short-sighted, it makes me want to beat my head against a wall.
Can I just add to that? Because I think Anne's analysis is correct, but it's generous, and it's generous because she looks at it as almost a philosophical question, a political philosophical question about multilateralism, when I see it just as pure political scapegoating. I mean, he needs someone to point a finger at. He wants to blame somebody else other than him, then accept responsibility for the poor response of the national government in the United States. And unfortunately, the World Health Organization is a convenient scapegoat for him.
Darrell was always a better politician than me.
Okay, well, we've got another question for you two, for Darrell and Anne. Leadership in a crisis often requires exercising different and unusual power. This is why emergency powers and legislation exist and are needed. What is the role and place of accountability for leadership during and after the crisis? So I guess the opposition holding the government to account, making sure governments are accountable.
Well, I won't speak for Anne, but I never thought there was any shortage of that. It seemed like there was an ongoing process of accountability that went on, whether it was through the media, through the opposition parties, I suppose in some sense it depends on the way in which the government shares information. But I would like to think that both at the national and provincial levels, we were very transparent about both the decisions we were making and why we were making them, given the information that we had at the time.
And the Emergencies Act has built-in accountability in that if the federal government were going to invoke a public welfare emergency, they would have to lay that declaration before the House within 7 days. And then I believe it has to be renewed every 90 days. So you have to go back to the House. So technically speaking, if you, that particular piece of legislation, which hasn't been invoked, there is built-in accountability. But sure, I think in a crisis, accountability is very important. And to Darrell's point, it is almost day by day, isn't it? When the Prime Minister goes out, ministers go out, premiers, or I think in the case, for example, Sara, the United Way, you're accountable in the most direct way to the people you serve every day. It's face to face in a way that most politicians don't have to confront.
Absolutely. And I think it's so critical that from a relationship and a connection point of view, that we're always listening, always connecting. But you see it, you see the challenges day in and day out, and people also need a safe place to be able to have that conversation. And often I find that that's what United Way related conversations can sometimes present.
Okay, another question. I think it would be good for Sara and Darrell. It's got a lot of likes on Facebook here. This crisis has profiled the limitations of the provincial long-term care sector and its disconnect from the health system in many ways. Whether model of care, staffing models, funding, quality, safety, and risk management inequities. What do you see as the leadership imperatives to continue to address these inequities as society post-epidemic?
Well, I'd be happy to talk about that, because I very early on in my political career, I made the issue of long-term care, kind of a focal point of the work that I was doing for literally for years, and I think people in Nova Scotia, because we're always living in the now, would not recognize how far that system has come over the last 15, 20 years. It has gone through a number of transitions over the last, literally over the last 20 years. I mean, one of the things that we faced was we built a lot of the new long-term care facilities, but one of the important things was we retired a lot of the old ones, which were in terrible shape, and I can only imagine what kind of a calamity we would be having if it weren't for that. But the reality is, I think particularly on the staffing side, on the way in which the service is actually provided within those institutions, I think that's where the examination is now going to take place. And quite frankly, a lot of the workers who work in those institutions have been underpaid for years, trying to transition that into the public healthcare system. You would be surprised maybe to learn that long-term care system only became part of the Department of Health, I think maybe 15 years ago. It was run essentially through community services at one point, and then before that it was primarily private. And so the argument for funding in long-term care has gone on now for quite some time, as long-term care got moved into the Department of Health. And the reality is, and Ann mentioned this, and I think the last major investment from the federal government that went into the healthcare system actually happened in the Martin government. Mm-hmm. But the reality is that even today, the federal government's participation in funding for the healthcare systems in the provinces falls somewhere around 20%, and you can argue about what gets counted and what does not. But it's the federal government, especially with respect to the smaller provinces, that have the financial ability to be able to support the health services that are provided. And that has been a problem in our provinces. In fact, in the Atlantic provinces, just generally over the last 20, 25 years.
Mm. And even though, healthcare per se is not an area of expertise for me, but, thinking about the comment about the leadership imperative, and what stands out to me the most, and what I would really emphasize, is that what we learn, from this crisis will be our true leadership test. So when I was sharing in my brief remarks about the fact that, we're not going back to a previous version of normal. Here we are, what's coming next, and what is the legacy of this crisis? So I think the most important question in that leadership imperative is having the boldness to ask that question. What is the legacy of this crisis? And what does this mean, not only, as Darrell described, with a lot of knowledge in terms of the long-term health care and the health sector, but what is the legacy in terms of income? And you think about the creation of CERB and some other benefits that have been really have had a big impact and have rolled out very quickly on a national basis. What is that telling us about a living wage and minimum wage and other issues that might already be present, or not might, or are already present in our communities? So I think the bold leadership imperative question is, if this is something that's important to us as a community, involving all elements of government, all elements of community and business, how are we tackling and asking our leaders, elected leaders and others, to guide us through some really difficult and challenging questions that help our communities get stronger as being a permanent policy legacy, as either related to income, for example, related to housing, related to shelters, and related to other inclusionary practices.
Okay, I just got a message from Tracy on Facebook. I have a question for James and Sara on tonight's panel. The provincial and national briefings have been peppered with a mixture of slogans like "Stay the Blazes home," "Use your common sense," "Only go out for essentials," and "The selfish and reckless." As a result of this lack of precision, People in our communities are now engaging in shaming battles about what is considered essential, selfish, and common sense. Do you have recommendations for how to improve communication from leadership to help prevent people in our communities from turning on each other?
Go ahead, James.
The key
I have some
thing-
ideas too, but
the key thing for an issue like this is to recognize that it's occurring, and then once we recognize that it's occurring and recognize that it's happening, then it's to offer some type of recourse to get past it, to work through it, or to change and alter, to be nimble, like Anne was talking about earlier, when these kinds of situations occur. We have that need for consistency, and out of that need for consistency, though, there will always be disagreements as to what we need to be consistent about, which brings us back to the point about judgment that has come up several times tonight. Again, the best thing to do is to acknowledge that this is happening, that it's going on, and then this is what we should do about it. Again, the part then I'll go back to what Anne was talking about earlier, things that we need to hear. We need to hear, what do we need to do to move forward effectively? What do we need to do right now in the present moment to be able to move forward to where we want to go in the longer term? So by acknowledging that these kinds of differences are happening, and then trying to work through how do we respond to that effectively, that helps to move us in the right direction. Now, there's not a clean response to that. Again, none of this work in a crisis is ever easy at all. But being open, being candid, and being transparent about what we're dealing with and what we're facing helps move us forward very effectively. Sara?
Yeah, I would just add a couple of things to that. And I think that importance of empathy is really critical, and that's built similar to what Jim was saying, that we're all human beings, and giving that benefit of the doubt, that everyone has a different life circumstance, and may have a different connection point to all of the information that's coming at us every day. Some people who have more, potentially more privilege, may experience that content differently than another individual. So it's important to have that open mind and heart that we're all human beings. So remembering that, and that piece of messaging continuing to come from our government leaders is really, really critical. In terms of, and one other piece that I would suggest as a recommendation is when we're looking at our political leaders, really reaching out to all of the many community-based organizations who can be partners in the messaging, so that it's not only one person, or not that it is right now, but just in terms of take that as an example, so that in addition to the Premier and in addition to Robert Strang, then you have a whole network and team of organizations who are helping to convey a message as a collective, so that it's not, so that there's a team, so that it's organization compared to individual. And I think that's when that judgment piece gets really complicated and complex. So the more people that are talking about some of that positive way of treating one another and of doing what's healthy as a system, then I think we can really spread that messaging more effectively together, and that reminder that everyone is a human being, and not everyone might be making a good decision according to public health measures, but it also gets very risky when we are policing each other in that particular environment as well. And so anything we can do to get out in front of that and prevent that will really help our communities sustain their connection compared to create more divisiveness.
Just on that, I want to pick up on that point, because this is actually maybe the first time we've talked about policing. And so just in terms of building on this comment about, we've talked about being collaborative and engagement, but there's also this sort of stick element to it too, about policing authority. And, and there's obviously some sort of judgment that has to be made about when do you lean on the police to enforce standards, and when do we maybe go on a sort of more collaborative route, or maybe those things overlap at times. But it seems to me there's a pretty tough question to be asked about if you're trying to bring everybody with you and you're trying to be collaborative and we're in it for the long haul. So we don't want to be turning on each other, but there clearly has been over time increased reference to policing. Anybody have any observations on that about that relationship and the judgment involved in the policing aspect, when it's appropriate, when it's not?
I don't know that there's an antiseptic answer to that, but we're one of the things we acknowledge in the current circumstances is time, and the reality of the current pandemic is that kind of every day that goes by in which behavior is not modified in order to, create the safest possible environment for everyone is a day not only lost, but could mean the loss of lives. So this is just my judgment on this. It seemed to me that, the message started about what responsibilities people had to each other. And then it was gradually ramped up to the point where people said, okay, we've warned people for a long time. And now we're going to start to enforce the judgment that we think is necessary for people to make. And so I don't think it went right from kind of 0 to 60 on day one. There was weeks where the message was being communicated. It was trying to reach into the consciousness of the public, and then at some point we got to the point where the government said, look, we're now at a point where we have to start to enforce this necessary behavior.
Well, which is why the Premier of Nova Scotia said what he said, right? Stay the blazes home. That was a ratcheting up, but a gentle ratcheting up of the fact that, look, we've asked you nicely to self-isolate and social distance. And it's quite apparent, I think it was what, in Lawrencetown on the beach or somewhere, I'm not exactly sure, I might have the exact place wrong. On a nice weekend, all of a sudden the Premier and others see hundreds of people out enjoying the sun. And you, as a responsible leader, to your point, Darrell, when you're dealing with an infectious disease that could endanger others, you just say, okay, enough is enough, right? We have tried to go, call upon the best angels of Canadians, in that case, Nova Scotians. And so the Premier says what he says. And then you start to see, in the case of Nova Scotia, law enforcement at the border between New Brunswick and Nova Scotia. They're not arresting people, as I understood it, but they were asking questions and asking people to turn around if they didn't have a good reason to come into Nova Scotia. That was happening between Alberta and British Columbia. Albertans wanting to go up to the mountains on weekends, and British Columbia saying, no, please don't come. So you've seen, I think, governments responsibly trying to get people to do the right thing, but sooner or later, it becomes a situation where you have to balance the risk to public health against the inconvenience or the inability of some people to follow the requests of their leaders, and you will use law enforcement. I think the criticism will be in lessons learned that perhaps governments waited too long to, for example, that the government of Canada waited too long at airports and other places to use the RCMP, or CBSA, or that cities should have been sending out their local police forces to ticket people. You don't want to impose the big fine necessarily, but to either be out policing and saying, guys, unless you've got a good reason, we're going to escort you home, right? Maybe not ticket, not take people to jail. That would be extreme, although maybe I think that's happened in a couple of cases somewhere. But I think the criticism is more likely to be at the end of this, that governments took too long to deal with those people who were not social isolating or self-isolating and social distancing. Right. And I don't have a view on that yet, but I do think that government sooner or later has to act if people willfully ignore public health advice.
Okay, we're running out of time here, but there's one, I think, really great optimistic question that I think everyone could have a chance to just have a short answer on, and then Kevin will wrap it up. It was originally for Darrell, but I think I think everyone should have an opportunity to answer this this last question. Anne mentioned, it's from Jesse on Facebook. Anne mentioned that we have to use the crisis as an opportunity to make things better than they were before. What do you think this could mean in Nova Scotia or in Canada? You can say your answer nationally or provincially, but what's one thing each of you thinks we could look to make things better than they were before this crisis?
Good question.
Well, I think the obvious one is looking at the way in which the supply chain operated during the pandemic. The reality is that when it came to personal protective equipment and N95 masks, a lot of these, the 10 countries that produced 90% of these products, 9 of them put export restrictions in place. So that's kind of part of what caused the panic in the supply chain about how people were going to get access to it. And I think for Canadians, when they saw Trump talk about the 3M not being allowed to export masks into Canada and not understanding that the stuff that the masks were made of came from Canada. It caused us all to kind of, I think at that point, collectively pause and say, in the name of our own security, the security of our healthcare system, we have to start manufacturing these products internally, nationally. And I think that that is some good that is going to come out of this. I think you will genuinely see these supply chains start to become local, and something that many people have been pushing for in other areas for a long time.
I would agree with Darrell. I would make it more general in terms of further investment in the public healthcare system, systems, because there's not just one, across the country. And the supply chain is an important part of that, but human financial resources. The other thing I would say that I would like to see is that Canadians across the country come to realize that we are all in this together. And it's not about one province against another or one city, whatever the case, the argument might be, but that actually in times of crisis, you figure out what really matters and you pull together and you maybe put aside some of the much less significant battles that somehow before the crisis you thought were really important, but looking at your situation today and hopefully going forward, you realize, gee, you know what, maybe that wasn't so important after all.
Mm-hmm. I agree with that, Anne, in terms of focusing on what's most important. And a crisis like this puts a lot of things in perspective, including how we treat one another. And if I were to have, one lasting wish in terms of the impact of a crisis like this, it would be looking at health, from that social determinants of health lens. And how are we looking at permanent changes related to housing being a human right? Different issues around food accessibility and cost for our communities across the country, and income and equitable income reform. It's an opportunity to have some creative conversations around what may be next in all of those spaces as 3 examples of a broader determinants of health conversation. And I think there's a huge potential to do some really good work in that space.
I'll tie things back together to the common good, because if nothing else, COVID-19 has shown that we are all in this together. And what we have to do going forward is to reflect back on where did we stay focused on the common good and where did we lose that focus? And what can we do going forward that will help us stay more focused on the common good? Where did we recognize dissent when it was important? Where did we not do it? Whose voices did we include? Whose voices did we mistakenly exclude? Those are again, being transparent about those issues will all help us bring us back to the common good. So that keeps us on the larger question, also dealing with some of the smaller questions like the supply chain that came out. A lot of things that we'll all need to work on, but each one of those steps mean that we can get better. And if we are transparent, we are candid about moving forward, we will get better as we move on into the future.
Very uplifting note to end on, Jim, and to everyone else. I want to say thanks so much to Ann McLellan and Darrell Dexter and Sara Napier and Jim Barker for helping us start our speaker series on COVID-19. I think there's so many big issues. We touched on many of them tonight, and we're going to try to keep asking some of these questions during this particular crisis. And as it unfolds, we want to kind of penetrate some of these big policy questions. We're really grateful to those of you who logged on to share your time with us this evening. This event will be on our Facebook page and our YouTube channel, so you can watch it again until the cows come home. You might have some time in your hands at home where you want to watch this again tomorrow. Please feel free to share it with your friends. We'll be back here again Tuesday evening, next Tuesday, to talk about impact on tourism. So please join us then. Thanks again to the panelists, to the audience, and also to Warren McDougall and Jocelyn Rankin who helped to pull things together tonight. So thanks so much, and we'll see you again next Tuesday.
Okay.
Thank you.
Thank you. Good night.